And so I want to talk about the rhythm data that we're having. So I've mentioned this to a few of my patients, but something that I want to make sure is, that we are mining data. We are taking your data. We have some really smart folks on our team, a few mathematicians and artificial intelligence folks. And this is the point, is can we offer you information that as we collect data to tell us if something's working? So for example, we looked at Tolivit. So Tolivit is something from a Chinese medicine herb called the Gromwell root. They basically did a large screen of hundreds of molecules and found that this was the most potent one against COVID. Data from that company saying, hey, we're running like maybe 50% of people better. In our own data, 8 out of 24 have improved on this. But unfortunately, when we stopped it, it kind of went away. So is that telling us, hey, this is important for people who might have persistent virus? And so this is where we're going to continue to look at this to see if it's helping. The S1 non-classical monocyte. So we have mined this data in our patients. And what we are finding at Rhythm is that if you do test positive for spike protein in your monocytes, it tends to improve symptoms. And I have tried Maraviroc on lots of folks. And it really actually was one of the first medicines that drove me to going into long COVID. But really the fact that it didn't work on everyone was really the most important thing. And it's about finding out when this might work. And so I want to tell our patients, we've mined the data and it looks like this is what it is telling us, that it's important to get that test because it can tell us to use Maraviroc. Because Maraviroc doesn't come without side effects. It can cause liver toxicity extremely rarely, but also it can be expensive. So I just wanted to make sure people were aware of that. So I wanted to go back to our case. So in our case, this gentleman had an elevated prothrombin 1.2 level. Now, as an internist, I never used this level ever before. But this is a great article that was talking about using prothrombin fragment 1.2 in patients with acute COVID. And I'm boxing this off right here. What they're saying is prothrombin fragment 1.2 had a superior specificity and conferred a higher positive likelihood ratio on identifying patients with thrombosis, which is blood clotting. And then going here, so prothrombin fragment 1.2 may be a useful assay and potentially may be more discriminant than D-dimer in identifying thrombotic manifestations in hospitalized patients with COVID-19. So I wanted to go back to our patient. So what I did with him is I had his prothrombin level, and then I gave him Maraviroc, and then I gave him statin. And his prothrombin level decreased and his symptoms improved. So the level went down like that. We don't know yet if this is a good marker. There's lots of potential markers out there. But as a Rhythm patient, we're taking your data, we're applying things, and we're finding out what is a good marker on how this might improve you. So we make you all send a lot of surveys. So I apologize for that. But why are these surveys important? Because it is data, it is surveys on how scientists and doctors communicate. Hey, I publish an article and I say, the 30-year-old man, he improved. Okay, what does improved mean? Using an actual scoring system can be helpful. And this is one of the ones that we use. And his score went up, indicating that he's having improvement in the symptoms. And he says it to me himself. Hey, I improved. So that is my presentation for now. I really wanted to underline, this is a tough illness. The hard part about it is that people are putting their hands up and they're saying, we don't know what's going on. We know a lot of what's going on. We do. And we're searching. We're searching for labs that exist. But also at Rhythm, we have a lab. We have many talented people in our lab. And they are trying to invent new tests. And we will be giving these tests to our patients when they're available. Don't give up. This is, I think, one of the most important things in the history of the world right now. And I can't imagine what it's like to be a long COVID patient. But I've immensely enjoyed being a long COVID doctor. And as hard as it's been for me to try to find things to help people, I think about my patients and feeling alone. And I always just want to say that you're not alone and that we're going to keep looking. We're going to keep looking until we figure this out. So thank you, everyone.